Dr. Nimri.
Hello.
Thank you so much for joining us for the interview series.
It's my pleasure. It's my pleasure. I heard that you were interested in knowing about pharmacy overseas, especially in the Middle East, in Jordan, where I'm from. Originally Jordan. Of course, my name is Andy Nimri. Well, my real name is Amjad, but they call me Andy here because it's much easier. So I went to school in Jordan. Of course, in Jordan, when you go to school, it's not like here where you have to take 2 years or 4 years now as a BS degree and then go to the professional program. When you graduate high school, you have to have taken advanced science lessons in calculus, biology, and chemistry, and organic. And you do those again in 1 year, and then you go to the 4-year program in pharmacy school. So basically the later 4 years, year 2 through 2, 3, 4, and 5 are the true pharmacy program, which is in a way, which is after you get all your prerequisites. So you get your anatomy, you get your physiology, you get your biochemistry, starting the 2nd year, and also like pharmaceutics, you get analytical chemistry, and then you advance through dispensing, of course, the other programs of your rotations at the last year. At the time when I went to school, the constant emphasis was mostly on clinical and bigger extent towards industrial pharmacy, since industrial pharmacy, or the production of pharmaceuticals, is a more prominent business over there. So the process of making pills, capsules, manufacturing, processing, doing rotation and a factory for the manufacturing of pharmaceuticals had more emphasis at that time over there. Unlike here, now everything is moving towards the clinical pharmacy, which is very good. But what I've been noticing lately, even with the new graduate of pharmacy, they don't have for example, the sterility skills that requires the pharmacist to work in simply an IV room, makes an IV. I mean, you see technicians that are doing a very good job making IVs properly in a proper sterile fashion, unlike pharmacy graduates. Even the rotations in the hospital don't mostly involve any sterile preparations. So I think we're missing on that, and that can be explained now with what we see in the news about pharmacies, especially the ones that do sterile compounding, failing to meet the standards for sterility, because there is not much concentration on that aspect of skilled sterilization processes and the knowledge behind the sterilization. We took a whole year of classes for sterilization to understand how the process works. It includes significant amount of microbiology. So it was really a well-rounded in that terms, of course, because there was more concentration on the industrial aspect of the profession. Here, everything is switching to clinical pharmacy, which is very good. But I think, and now with the proliferation of compounding pharmacies and the science of compounding, again, getting first line status in the practice of pharmacy, I think we need to go back and re-examine the education in terms of maybe reintroducing sterility, reintroducing compounding as a major part of the education, process.
So you're saying in Jordan you had a full year where you were studying
sterilization, yes, just like medicinal chemistry, just like industrial pharmacy, just like from therapeutics and those things. So it was as important, which I don't see it is of any significance here in this country these days. Like, for example, another example, which I think is very important because it's something I enjoy, is plant chemistry, or the science of getting medicine from plant. Here there is not any concentration of phytochemistry, basically. Mm-hmm. There is not any concentration. It's like an elective course. In fact, I know some people that took an elective course in that, which I think this is very important, especially when you are a pharmacist or a doctor or a healthcare provider, and you know what you studied and you talk about only what you studied, you're a good provider in that terms. But if you start talking about other things that are patient getting interested in, okay, then they'll say you're a well-rounded professional. Well, this is at the age of a highly educated patient, and we are confronting patients that have a very high caliber of education, easy access to information. It can be bad, good or bad, but we still have to address it as the providers. So I think plant chemistry, especially the fact that a lot of drugs are made originally out of plants, and chemotoxic agents are plant, mustard-based, cisplatin, all these drugs have in a way or another relation to a plant origin. So I think the emphasis on this side of education as a mandatory part of pharmacy courses, I think, would be very nice addition to reintroduce the pharmacy to its origin. I think this is what we're missing here in this country. Of course, there is a better education towards the clinical pharmacy. I have, the graduates here are well exposed to the clinical aspect of the pharmacy, especially the last year and a half of rotations, where they get exposed to different ICU rotations, oncology, pediatrics. This is all very good and important, but at the same time, you will end up, working, even if you work in a hospital, you still know the sterilization processes. What if you're a department manager and you have to execute 797 and all these regulations? You have to know what you're doing. You have to have done the sterility test them yourself, and even if you're not going to do it on a daily basis, but you still have to know what's going on and execute the rules and the policies that like the Pharmacopoeia Institutes and so on.
In Jordan, is there a high trust level on herbal remedies? Is that something that's commonly accepted?
Yes, it's commonly accepted, and people look for it, especially when they have, they tried every prescription product that there is. They give up on it. So a sick person will look and try and find an alternative way because they just want to get better.
Is it generally a first-line thing that a patient will do, say, and go and look for an alternative rather than
some people, but not likely. No, usually the patients will do this as an alternative way of treating conditions, an alternative medicine, an actual healing processes aren't working, and some people use it on a prophylactic, as a prophylactic medicine, where they just take different herbs and vitamins to prevent further diseases.
If a patient came into the pharmacy and was asking for a particular medication, is it common for pharmacists in Jordan to say, wait a second, why do you think this, and begin a one-on-one counseling session?
I think that would be a good opportunity to start educating the patient about these things. Of course, you cannot prevent some people from doing whatever they want to do, but at least having an input in advising them to get the right source of treatment, along with the knowledge that they have, is a very good attitude and a very good practice.
So how accessible would you say is healthcare in Jordan?
It is accessible. Of course, there is a private sector, there is the government sector. Insurance is not as highly adopted over there as it is in here. There is a lot of dependence on insurance companies in this country versus, I probably would say overseas, not in Europe, because Europe, they have the national healthcare systems. In Jordan, there is, of course, that part, like the military people are insured through the military all their lives, like we have here for the government, for the veterans, for the TRICARE insurance. There is not the Medicare that we have here, that social comfort thing that when you're 65 you're going to get your insurance done. There is not something like this over there. There is a way you can save for that, like more for retirement, but not for healthcare that I know of. There is the government insurance like Medicaid, of course, for the people who are below a certain income level, that they can get access to that. Of course, that quality of that healthcare is debatable.
Lots of limits on coverage,
absolutely, a lot of limited coverage services. Now we have a cancer center, very famous cancer center called King Hussein Cancer Center. It is close to University of Jordan. It's also an institution for teaching, and this has been very good. They do a very good job. In fact, I know a clinical pharmacist that went to school here, and now he's running the pharmacy department over there. and they do very good in that. And also, cancer treatment is free for anybody, so you don't have to be below a certain poverty level to get that. So that's a very good thing. The government, in terms of the military side, they get very good treatment, actually better than the government side, the non-military side. So they get very good treatment. There's big centers over there. Of course, the country now, is a place for a lot of foreigners, which I mean foreigners like from the other side of Middle East, from Saudi Arabia, Emirates.
Do you mean tourists?
Tourist in medicine, so medical tourism. Yeah, medical tourism is a very big business, because these people, they want good treatment and they don't want to go very far, like going to Europe or the US, which is going to be a lot more expensive. And they have very good quality medicine and pharmaceutical care medications available, where they can pay significantly less for and get a very high quality of treatment from doctors and providers that are educated in the country and from Europe and the US. So this is really a big part of the economy, actually.
So as far as cost goes, do you think there's as much reliance on insurance like there is in the United States?
Absolutely not, no.
So you never have a situation where someone who is impoverished would never be able to afford their treatment?
Well, they will get their treatment, okay? Now, how quick is it they're going to get the treatment, how efficient the treatment is debatable. Now, in this country, you can get a very good emergency treatment, but that is if you don't have any insurance or below poverty level. But that doesn't mean you're gonna, continue getting a very good treatment. Over there, to get good treatment, you have to have money. Basically, you will get treatment, but to get good treatment, you have to have money.
And so the cost is much less than in the United States, you would think?
Per procedure, even per medications, yes, absolutely. It's much, much cheaper to get medications over there. There are a lot of medications there. I don't know about the rules when it comes to patents, whenever the drug loses patent on, I think they might be different over there, or like they might allow certain medications. Like, for example, I heard that the medication, Harvoni, the one that's for hepatitis C, the new medication, which is $1,000 pill for 3 months, so that's $90,000 for Hep C treatment. Gilead is the company that makes it in this country, and of course sells it overseas. So I heard in Egypt, because Egypt has a very high rate of hepatitis C, in fact it's the highest in the world, they allow it through the government for $400 a month. So you're talking $400 a month versus $30,000.
Wow. Is it like a payment plan, or is it
No, it is. It's no payment drug. You have to get it through the government so that they can control the supply chain. Okay, but
so it's a completely reduced cost.
I mean, 400 versus 30,000. I mean, the number speaks for themselves, So I think drug companies here, of course, they have to, make money to research and all these things. But I think the insurance system in this country, along with the government, provide significant amount of this research money that everybody else is benefiting from it overseas at basically our cost. So, I mean, it's a good thing we're helping all these people. Like, for example, Hep C in Egypt is, drug like this would be great help. It might even help eradicating the disease from in 10, 15 years, we might not have the disease.
And the accessibility of $400 a month is...
It's not, and it's sponsored by the government, so most likely the government will end up paying the $400. It's not like, the people will even pay the $400. So it's free, basically. I heard that about a year ago when they were planning on launching the Sovaldi, which was the precursor of Harvoni, which is the combo pill for Hep C.
Okay. So, in addition to all the people coming in for medical tourism, Jordan has recently opened up its borders for Syrian refugees, and so there's kind of been an inundation of Syrian refugees into the country. Obviously, they're going to be limited in what they can afford and what they can pay for. Is there a system in place for how they receive health care or medications?
Well, I've heard that there are camps, like in the northern part of the country, that these unfortunate refugees have to stay in. And this has put a lot of strain on the economy. The country is not, in Jordan there are no natural resources like oil that you can just pump and sell and make money. So basically the location of it is of great interest for big powers like the U.S. and Russia and Europe, to make sure it's a well stable politically, and of course that requires economic stability. But the refugee situation has put a big strain, especially on the healthcare system. In fact, there is a lot of foundations that go from this country. There's one called NAMA, which is National Arabic American Medical Providers here in this country, that have provided trips to the northern part of Jordan, and as a volunteers in medicine to help, and they take medications and they do all these things free for them so that they can help them. But without a doubt, this had put a lot of pressure on it, and I would imagine that when it comes to the pediatric population, that will be a more short and long-term problem, because like vaccination would be a big issue. There is not a control on pregnancy, and there are families living, so you would expect to see some kids, and there is no birth control methods that are well documented to have been enforced or used or recommended. So I think the issue with the old diseases that we have almost eradicated, that might come back. Maybe issues with TB, things that come from close people living, a lot of people close to each other. A lot of help comes from United Nations, from the big countries like the US sends a lot of help, Europe sends a lot of help, Japan sends a lot of help, but I think it's a very big problem.
So in addition to the help that other countries are sending in the form of humanitarian aid, is the global community stepping up to supply monetary aid to Jordan because of the burden that it's putting on the economy?
They are, but I don't think they're sending enough. And I think the humanitarian disaster cannot be solved with money only. So there's so much people and so limited space, even in the city, and the country just cannot support all of this. And this will have a short and long-term humanitarian effect. Short-term, people will get nervous, upset. They might, have anxiety disorders, maybe because of the stress that this puts on people. On the long term, they might have other clinical conditions that can develop from this, maybe infectious in nature. We cannot really quantitate the damage that's going to happen on a long-term basis, but I am sure there will be no doubt that there will be some medical issues that will arise as diseases spread and so on.
We've talked about how accessible healthcare is, but how about when you leave big cities like Irbid and Amman? What are the options?
The best medicine, of course, you will get in the bigger cities like Amman. Irbid is the north side. They do have good, very good university, and they good medicine too. But of course, when you go to to the little small towns, accessibility of emergency medicine is going to be a little strained, and especially in the south also. You would have, look, like here what we do in this country, for example, stroke is a big problem, but we have, especially in Jacksonville here, we have very good EMS services, okay? Jacksonville is very good with EMS services. When it comes to conditions like stroke, somebody looks at you, you look like you have a stroke, you call 911, you're there in the hospital, within an hour or two, you would getting your alteplase running. So this is the speed, the efficiency that we have developed here in this country, of course, because there's a lot of money to use for that reason, is just amazing. It's just so nice to see how efficient things run here, especially with a condition like stroke. Like hospitals have to be code stroke certified, they have to have systems in place for treatment, quickness, like cardiac cath, you get a STEMI, you go to the ER, and they get you in the cardiac cath lab. Within an hour, they will open you up, get your catheterization done, and that has a lot of future savings in terms of the cost of healthcare, especially for stroke. No, of course, this, we have a lot of factors that helps in this. Again, very important is our EMS services here. The quickness, the roads are open. There's so much efficiency here in getting to the hospital. Everybody will move. Over there, it's a very highly congested cities. So even in the big city, you still have first, you have to have mentalities that will think that this is a stroke and it can happen to me and my loved ones. And when you get to that barrier and pass it, then you have to be quick in implementing the treatment and take them to the doctor and solving or the hospital and solving these. Here we have live flights that can take the patient from one place to the other very quickly. Over there is not the efficiency system, and even if there is limited supply of this, not many people can afford it. So here, when we have somebody with a stroke situation, we don't think who's going to pay, how is it going to be paid. We want to get it done quickly and get him better and prevent further problems. Over there, that's not the first line of thinking that happens.
Okay.
Because money is a big deal.
And even in the big cities, even if you had that infrastructure in place, just with the congestion alone,
yes,
it makes it very
difficult for an ambulance to move and get things in. Because, in stroke, they say time is brain. Mm-hmm. So we don't, it's very hard to execute something like this.
With education in Jordan, it seems like there's a lot of options for pharmacists to receive an education and continue their education in pharmacy.
Yes.
And there are ever more increasing numbers of students that are graduating from these programs. How many people would you say stay in Jordan to practice as pharmacists?
Well, lately education has been a big business, especially in Jordan, just like medical tourism, because we have a lot of highly educated professors that got their education like PhDs from Europe and the US, mainly England and the US. In fact, I was taught with a lot of graduates from US here with their PhDs. And there are several universities now. A lot of them are private, and they capitalize on the fact that we have all these professors from bringing students and potential students from other parts of the Middle East, especially like Saudi Arabia, Emirates, Kuwait, Iraq. I have few students actually that want to do their internship here that are Iraqis and went to school in Jordan. I actually have an intern that works here. He is Iraqi and he went to school in one of those private universities in Jordan. And so they're producing a lot of pharmacists. So all these pharmacists that are usually not from Jordan, they go back to their countries. And significant amount of the pharmacists that are originally from Jordan, they leave to the Gulf region because there's a lot of money over there. There's more jobs, it's more affluent areas. And some of them go to Europe, some of them come to the US. So it's really very diverse, and a lot of them stay there also to open their own businesses, although lately, just like I said before, there's so many pharmacies, so it's getting to be very competitive. In terms of business aspect, now the good thing over there for them is that the prices are controlled by the government for medications. So an XYZ medication, an atenolol 50 milligram price made by an XYZ company has the same price regardless where you go. And usually they have like a 20% markup, which is very generous if you compare it to US here, because here in the US with insurances, a lot of times lately we've been losing money, not even breaking even. So the profit margin in a way guaranteed by the government. Now some people, I've heard some pharmacies discount that to attract more businesses to them. But that's supposedly not the way to do it over there, to do it correctly. But like some people would discount the 20% to 15 or 10% to attract more patients.
So the pharmacies, they can't raise the price because it's set by the government,
yes,
but they can reduce it to...
Well, they technically cannot, but they do reduce it. Of course, they can't raise it because, you can go next door and get it, for the regular price. But so there is that competitive edge, if you will, in terms of market, to attract more patients to your location.
Is it like the US where you always need a prescription to pick up the medications that the pharmacy sells?
Well, technically, you do need a prescription every time, but that's rarely executed. So, a lot of times you would go to the doctor, get your blood pressure checked or cholesterol, and start on a medication, but the patient doesn't go every month to the doctor, or doesn't, like, the pharmacy doesn't call for a refill and so on. A lot of pharmacies these days have computerized system, but it's not the way that we have it here, and as in terms of communication, because money is strict over there. There's not many people with a lot of money, so adding another doctor's visit to get a refill is not something that people would do. So they just go to the pharmacy and get whatever they need, except whenever it comes to controlled drugs. Controlled drugs is by far not popular over there like we have it here. I've read a report saying 90% of opiates produced in the world is consumed in the US. So in the US, we're highly dependent on opiates for pain, for anxiety, wherever clinical condition. Overseas, including Europe, they're not as attached to opiates as we do have it here in the US. So it is more enforced, or definitely enforced in Jordan, as to getting controlled drugs. But it's controlled drugs in general not that popular like they are here. So basically the pharmacy will not issue a controlled drug without a prescription, and that is something that's audited highly over there. But when it comes to antibiotics, when it comes to blood pressure, maintenance medication, and so on, like, you can go to the pharmacy and get an antibiotic with no problem.
Can you elaborate a little bit more about why controlled substances are maybe less popular over in Jordan, the Middle East?
Well, either less popular. Well, maybe it's not definitely less popular there. It's definitely more popular here, and the reason it is a lot more popular here because how pain is addressed. Of course, it comes back to the personality. A lot of people would avoid a pain pill at any cost. They just don't want to take pain pills. In the US also, but the mentality towards pain in Jordan is a lot different than here. People would try to basically just manage their pain by tolerating it more, without the use of medications. Because as you know, opiates are very addictive in terms of like the first time you use 2-3 pills a day, next time you use 4, and this is a never-ending cycle. There is no ceiling for opiate dose. There is no 4 pills a day would work for everybody all the time. This doesn't happen in opiates. From as you know, from pharmacological standpoint, how the drugs work. But in this country, pain is addressed differently. Pain is a condition that has to be managed in this country, and this had started getting worse in the early 90s when JCO, which is the Joint Commission for Accreditation for Hospital, basically measures the outcome of treatment for the patient in the hospital with the pain. So pain is a component of how good your hospital is doing a good job or not. So basically, and it's still up to now, when somebody is discharged from the hospital, if they're Medicare, they have to fill a form, and saying how the hospital treated you in terms of, did they counsel you about your medication? Did the nurse do her job? Did she bring you the medicine on time? Did the doctor see you, spend time with you? All these things as basically a way to measure outcomes, because now insurance companies, and it's going to happen a lot more in the very near future, and with pharmacy also, is reimbursement will be based on outcomes, because they want the final product to be a good outcome. But JCO has, since the 90s, has enforced the fact that pain has to be treated, and if you stay in the hospital with the minimal amount of pain and the hospital has addressed your pain, that means the hospital is doing a good job, and that's what created the culture of basically every physician, every provider, every institution has to treat pain and make the patient in the minimal amount of pain. That's good when you're in the hospital, but when you leave, this is going to carry over, and some people are very, very highly prone to addiction with it. That's how they are, and they just easily dependent on pain medication. They leave, doctor gave me in the hospital this medication for pain, I would like to get it from my primary. They go and get it from my primary, 1 month, 2 months, and so on, and you get a culture of pain. So this is actually a main reason, I think, why people are more dependent on pain medication. Of course, the ease of getting pain medications, it's in our culture to treat every condition with a pill, from your depression, from your infection problem, whatever it is, we want a pill to treat everything, and pain is a major one of those two. I work at a hospital also, I cover on the weekend, I cover the ICU at Baptist South, and actually this is one of the least hospital that we have pain medication problems, but it's still, you would see that there are patients that are coming to get their pain medications. The fact that there is not much I think the control on the dispensing path of pain medications on the outside is a lot more versus the inpatient side. Because the inpatient side, the patient's going to stay 2-3 days. Nobody's going to care how much dilaudid I got, Mm-hmm. So, but if this keeps on happening on a very repetitive manner, then this is a big problem. And I think this is a major factor that probably needs to be addressed in this country, is not only how much pain medicine is spent on the outpatient side, is the inpatient side also, that really nobody can track. It's very difficult to track. Nothing you get in the hospital is reported to E-Force, for example. So.
Obviously, you're very educated and you know quite a bit on the clinical side as well as the community side, and you're educated in the industrial side as well. Do you feel valued as a healthcare provider when you speak to physicians?
Yes, I think the value of the pharmacist from a physician perspective is higher here in this country versus in Jordan. Here we concentrate on different multidisciplinary approach to healthcare treatment. So we have pharmacists, PAs, nurse practitioners, nurses, radiologists. We have team approach, well-established team approach, and each one depends on the other and creates a very well-organized matrix for delivering a better healthcare. But in Jordan over there, the physician feels like they know everything, okay? And but that doesn't necessarily carry on to the community. The community values the pharmacist highly over there, okay? Here, probably the community doesn't value the pharmacist. They do, but not to the same extent that is valued over there. I think the services of the pharmacists are much valued over there than in this country, although we have got over the years very good rating from consumers. But from a provider physician to a provider pharmacist, I think we are more dependent on here in this country versus there.
Is there anything else that you think would be interesting for a pharmacy student to know about your experience in Jordan, or even compared to here, what your experience in Jordan is?
We have very good graduates here. The curriculum is very advanced, but I think we should, like the last year and a half in rotations, it's more clinical in its nature, which is very good, but we shouldn't really lose touch with the basics of pharmaceutics, the basics of drugs, how it's made. Things are eventually gonna go back to the compounding methods. Like here we do hormone replacement treatment. Most pharmacies won't do hormone replacement treatment because they're just not familiar with the subject. And something that the chains might have kind of in a way controlled the profession, because that's something they're not interested in doing, because it's just not worth it for them to do it, because they have so many stores. If one store has to do it, the other store has to do it, so it makes it difficult for them to do it, which is understandable. But again, that's affecting the profession, affecting the education. So I think the graduates now are very well rounded, but I think there needs to be a more emphasis on the industrial aspect, just working in the hospital, not doing rotations, working in an IV room, for example. Preparing TPNs physically, not just putting them electrolytes, and them just have to be in there and learning how to do this. Maybe spending some time in a compounding lab in a pharmacy. Considering taking a class in natural medicine, natural pharmacy, herbal medications. Pharmacognosy, which is a very difficult subject. Pharmacognosy is a very hard subject, but I think it's very good when you graduate and you can rely on something that has a plant-based component to it. I think that we'll have a more rounded graduates.
I think a great thing with this series is that you get to see the differences, not necessarily the disparities, but the differences in how healthcare is run from one country to the other. And from your experience in Jordan, it's easy to see that there are some areas of the pharmacy curriculum here that could be improved. And we can also take from the experience here in America and translate that to Jordan. And it's a great way to kind of learn about all the different cultures and build the education on what works and what doesn't work and what needs to be improved.
Yes, I think we have to be very adaptive, especially in these days. And I think the more adaptive you are, I think the better your final product will be.
Well, thank you so much for coming in and
You're
doing this
welcome.
interview. I really
Thank you.
appreciate
Thank you
it.
very much. It's my pleasure.